Hi folks, and welcome to A&P with Dr. O. We will conclude our discussion of connective tissue proper with elastic connective tissue. In a moment, we'll talk about supporting connective tissues and we'll talk about elastic cartilage. That's different. That's a different tissue and a different classification of connective tissues. If you need to make yourself a note that to remember, you can. We do not want to confuse with elastic cartilage. And you'll see in a minute that visually they are very different, and again, they are in different classifications of connective tissue, but we just want to make a mental note that they are two different tissues. Elastic connective tissue, elastic tells us about the fibers in the matrix. That means we're going to have elastic fibers. They look similar to how we saw them back in areolar connective tissue. So they're kind of darker. You can see these dark fibers, running through all portions of this tissue, and all of these dark bluish purple fibers are going to be elastic fibers. And all of the tissue that we can see here too, all of this tissue is going to be elastic connective tissue. And elastic connective tissue is going to be found between vertebrae of the spinal column, ligaments supporting the penis, ligaments supporting transitional epithelium, and it's also found in certain blood vessel walls. And it's going to function to stabilize the position of the vertebrae and also stabilize the position of the penis. It cushions shock, and it permits the expansion and contraction of organs, which should make sense. When I think of elastic fibers, I think of an elastic band or an elastic rubber band. And if you think about a rubber band, an elastic band, we can go ahead and expand that elastic, but once we let go, it returns to its original shape and size.